Swatche, and welcome. This is Anne from the Sioux Lookout Practice Consultant Team, and you're listening to the Practice.Support podcast, the one and only show that discusses new practice updates and changes for ISC's Ontario region. Coming to you with acknowledgement to the Anishinaabe Algonquin Nation, whose traditional and unceded territory this podcast is recorded on, and with respect to the different traditional Indigenous territories of Turtle Island that this podcast may find you. Hello all. On today's episode, we have Kevin, a nurse practice consultant for the Kashechewan and Peawanik areas in Moose Factory region. He's an RN who comes to us with a public health degree and a varied background in Emerge, EMS, occupational health, and northern health. Welcome, Kevin.
Hi, Anne. Thanks for having me here. It's great to be on the episode today.
So what are we speaking about today, Kevin?
Well, I was hoping to discuss a bit about Group A streptococcus, also known as gas, and gas pharyngitis.
That's a good one to cover. Group A strep is a pretty common clinical syndrome in primary care.
Absolutely. It's one of the most common bacteria that we encounter daily, and gas results in acute infections with a wide array of manifestations, from pharyngitis to necrotizing fasciitis. Unfortunately, though, we can't avoid gas, as it's found as normal skin flora and in the environment around us.
That's a good point. Are there any specific considerations for gas in our practice setting?
There are. So, one Canadian study reported pediatric acute rheumatic fever incidence is up to 20 times higher in First Nation communities of Northern Ontario. Additionally, gas outbreaks in First Nations communities made up 46% of cases, which is 10 times higher than the general population. And nurses also need to be on the lookout for complications that may occur for Group A strep, such as glomerular nephritis syndrome, post-gas infection in kids, which, while rare, can occur. And if gas is left untreated, rheumatic heart disease and rheumatic fever can lead to significant cardiac disease burden as well.
Those are some serious statistics, Kevin. What should nurses consider when thinking of gas?
So typically, nurses should keep in mind that pharyngitis, secondary to gas, occurs most often in the winter and early spring, and 15 to 30% of pharyngitis cases in children and 5 to 10% of pharyngitis cases in adults are caused by acute gas infection. With any case of sudden onset fever, sore throat, and or anterior cervical lymph node tenderness, nurses should consider a gas infection. The clinical care pathway for head, ears, nose, and throat can help navigate these cases and consider other differentials and clinical mimics, such as an upper respiratory tract infection, the Epstein-Barr virus, or mono. Our clinical care pathway has the center score to act as a guide, but doesn't replace your critical thinking skills, i.e., just keep your problem list broad. As a reminder, pharyngitis is an automatic consult now, as there are no head, ears, nose, and throat medical directives at this time, and gas is a time-sensitive bacterial infection. As such, discuss with your ordering provider if it's appropriate to start antibiotics while awaiting the confirmatory lab results. And antibiotics can always be stopped if the culture comes back negative for gas. One sort of key important thing to also remember is if you suspect a gas infection, it would be prudent to perform contact tracing to see if anyone else is at risk.
Those are some excellent points to consider, Kevin. If the nurses wanted more resources on gas, what would you suggest?
As always, the head, ears, nose, and throat clinical care pathway is an excellent clinical resource. Nurses can also check out the Canadian Pediatric Society website on Group A streptococcal pharyngitis for more background information as well.
That's a great resource. Thanks for coming by and having a quick chat about Group A strep with us, Kevin.
Thank you for the time, Anne. It's been lovely.
Thank you all for listening to the Practice Support podcast. If you're keen to follow up on any of the information you've heard today, head on over to One Health and iTacit, where you'll find more links and resources. For more practice updates, don't forget to find and follow us on our Instagram, Facebook, and YouTube channel at SLKT.Nursing.Practice.Support. And as always, if you have any questions, please reach out to a nurse practice consultant, an education practice advisor, or your manager. That's all for this episode, folks. See you at our next podcast.